Okay, we're going to talk about topical versus oral compounded medications for hair loss. Now, these two agents that I use, dutasteride and minoxidil, have been the most powerful treatments I have in my medical non-surgical hair loss practice. So they are almost essential to get on if you are concerned about your hair, and that's why it's really important to find a formulation that works well for you. And the two formulations that we have are oral and topical sorry, the two formulations we have are oral and topical. So we have to get down to which one of these is going to be better for your case. We're going to consider which ones are more effective and which ones have side effects, and also just the kind of feel and ease of use of these two things. So let's get into the topical. This is probably my most common form prescribed compound that I have for hair loss. It usually contains dutasteride and minoxidil. Dutasteride blocks hair loss by 85%, and minoxidil helps stimulate hairs into the active growth phase. So used in combination, these things work extremely well. Now, the topical, it's a once daily use. It's not a twice daily use like most minoxidils, and that's because we use an exfoliant in our compound. It allows us to make a lot more ease on the convenience factor. The topical tends to be non-irritating. The only problem is just compliance. A lot of people have a hard time using the topical on a daily basis, and sometimes use it every other day or every 3 days, and you just don't want to be doing that. So if you're not someone who has a daily routine for like skincare or hair care, this may be something that is not ideal for you. But I can tell you from a side effect profile stance, putting on a medication like dutasteride topically prevents its penetration into the body and leads to a lot less side effects, probably dropping from the 5% associated with oral hair medications down to a fraction of that with topical, effectively eliminating any issues with libido and erectile dysfunction, although those are rare to start with. But if you're experiencing those on oral, topical is a great way to go. So what's one of the downsides about topical? Well, it has this little oily residue. For most male clients, it's not a big deal because your hairs are short. You can apply this directly to your scalp, and the hairs tend to be thicker than in females. So you can apply this directly to your scalp, and sometimes it actually helps with your styling. But if you have very, very, very thin hairs in a particular area, then applying this can actually weigh down the hairs, tend to make them like stick together, and maybe accentuate the appearance of hair loss. And that's why most of my female clients have a hard time with topical minoxidil too, because they tend to have hair loss in the central part line and they don't want to make it look any thinner. Also, if you have a significant amount of hair loss, like my female clients who have hair thinning not only in a pattern down the middle, but also on the sides, actually apply this all over your scalp can be a little bit more difficult. So from a practicality standpoint, a topical may or may not make sense or feel good to you for that reason. So that's why oral forms exist, and oral forms are great, but what is wrong with orals? We're putting a drug in the body for our hairs. We don't need it circulating around the entire body to affect the hairs. Now, some of the medications are more compliant when are more effective when using them orally versus topically, and specifically minoxidil. There are some studies out there that show that oral minoxidil is better than topical, and it probably relates to the fact that about 40% of minoxidil topically gets stuck in dandruff. That's not that big of a problem with our compound, is what I use salicylic acid, which is an exfoliant that helps kind of get rid of that dandruff, allows minoxidil to penetrate really well. So if you're using minoxidil topically and you want the same effectiveness as orally, make sure it has some kind of exfoliant within it. Now, minoxidil is also a blood pressure medication and can cause body hair growth. And by taking it orally, you actually put yourself at risk for those, whereas taking it topically, that risk is extremely low. I can tell you that some of my female clients, if you take minoxidil and you leave it in while you go to sleep, it can get on your pillow and it can get onto your cheeks. Some people do note some increase in like kind of peach fuzz. So it is possible to get body hair growth with the topical. You just gotta be more cautious. Now, dutasteride. This is a big medication to be considering whether you should take topically versus orally, and my preference here is to take this topically because dutasteride works by preventing the conversion of testosterone to DHT. And DHT is that molecule that binds to your hairs and causes the thinning. Unless we really, really want that to happen throughout your body, such that, let's say you have a prostate issue and you want to have that, effect also, we really want to keep this isolated to the hairs. So if you can get away with the topical dutasteride, you're probably better off than an oral dutasteride. But sometimes the side effects of dutasteride we may not notice. Like a lot of people will notice libido, erectile dysfunction. But what if it's something as simple as sperm count? We don't really know the total effect of that until we get in a situation of trying to have a child. Now the risk of that's very low, but it's something you got to consider. And going topically just makes total sense if you're at all worried about that. So what does this come down to? Well, dutasteride is probably to be used, better to use topically because it works great topically and it has low side effects topically, whereas minoxidil tends to have better effects orally, and the side effect profile is actually pretty low orally, even though it does exist. If you want to use them both topically, then obviously you want to have the exfoliant in there to decrease the dose of all of them and make them more effective. So hope that helps you make your decision. I personally use topically. I don't go oral, but I have plenty of clients who do fine on oral, and it's just something we have to figure out what fits their life, and we go with that.